Hello everyone, welcome back to our new video which will be about the examination of the ulcer. In the previous videos I had already told you about the steps which is important and necessary before starting any examination, and we have done another video of that for examination of lump. In this video, this will be again a simple and small video, and according to mnemonic you will have to follow the mnemonic and you will examine an ulcer of the patient. This one is also a simple one. Okay, I already written that ulcers have beds. This will be our mnemonic. The most important thing will be beds. You will have to remember beds. If anyone told you that examine an ulcer of the patient, you will have to follow this mnemonic. Number one, we will come towards the mnemonic, and it B, E, D, and S. Number one, starting from the B. B stands for base. Okay, and now coming towards, I just further repeat so that people can memorize and remember the steps. First, that was wiper. Remember wiper. Before any examination, wiper. And this examination will start from the washing of our hands. And after that washing of our hands, then we come towards the introduction. Okay, washing hands, introduction, permission, exposure, and repositioning. In this case, we will start from washing our hands, and then we will start from introduction. That for example, I am Dr. Sanaullah Khan, one of the resident surgeon. And then a small and bit information about the patient. Can I confirm your name and age, please? Just for the confirmation of the patient. Then we'll start permission and taking consent for the examination. Like it will be informed consent. You will have to tell each and every step of your examination to the patient, so that after giving consent, you will expose the patient. For exposure, you will again take consents, and after that, you will reposition the patient according to your examination. Once you have completed all these 5 steps, then we will come towards the examination of the ulcer, and that we will start from beds. B for base, and that you will just examine the base of an ulcer. For example, here it is an ulcer. Okay, so this is the base. We will check the base. Okay, and base, it could be either granulation tissues, or it could be any slough or things like that. So maybe we find some pus coming out of our hair. Like, you will just examine the base, and you will tell examiner accordingly. Okay, so first of all it was base, and after that we will come towards the edges. Edges of the ulcer is really important, because many of the edges told us about the diagnosis. Like I'm just telling you some of them. Like if it is having sloping edges, which could be due to trauma / venous could be also sloping edges. Then it could be punched, and in punched it could be due to arterial ulcer, venous ulcers, and here it is arterial ulcers. Difference between the two: if it is sloping, it will be venous ulcer. If it is punched out, it will be arterial ulcer. It could be undermined. I hope you people understand what undermine means. It could be due to tuberculosis ulcer, right? And after that, we can find as rolled edges. It will be due to BCC, basal cell carcinoma, right? And we can also have everted edges, and everted will be due to squamous cell carcinoma or Marjolin ulcer. So only examining the edges of the ulcer could tell us many things which help us in the diagnosis of the patient ulcers. Now coming towards the discharge, right? D for discharge. We will check if there is any discharge. It could be due to discharge could be, just I will mention it here. It could be serous, purulent, sanguinous, and combination of the serous sanguinous. Right, after that you will just check the structure, visible structure in the base of the ulcer. Like we will check it over here that either it is muscle, vessel, or anything which could be seen, or maybe it could be bones. So we will check for the visible structures. I hope so you will have already understand each and every step, but just for repetition, in examination of an ulcer you will find something, a mnemonic, very useful mnemonic, and easy, which is BEDS. In BEDS, B stand for base, and E stand for edges, D for discharge, and S for structures. And I already mentioned each and every structure which you will be seeing in an ulcer. Okay, so if you people want to do any other video and any other topic, kindly comment. We'll try to make a video about that topic. Okay, thank you so much, and kindly subscribe our channel for new and interesting videos about medical. Thank you so much.